So I'm here with Sarah. Sarah, welcome. Just finished up the I Got It Right event. And what'd you think of today, Sarah?
Oh my God. I was just telling my fellow sisters that I woke up this morning early at 3, 4 o'clock, feeling really bad.
Yeah.
I know I'm still grieving over my husband and his loss, but with the lupus, it's a big support for me.
Yeah.
Especially when you have sisters like I have here that understand what I'm going through.
Yeah.
You know, in the way the world is today, you got a lot of people that don't know about a lot of illnesses, and lupus is one.
Yeah.
And knowing that I came here today and a lot of information that I didn't know, I found out today.
Yeah.
And some of the speakers that got up and spoke, the things that they say, it helped me out a lot. The encouragement, the support, the love, the knowing that, I'm not in this alone. It's genuine. It makes me feel good. It makes me feel like I'm not by myself.
So you're a patient. Was this your first event with our organization with the Lupus Foundation? Okay.
Yes.
And how if you don't mind me asking, when were you diagnosed?
I was diagnosed in 2019.
Okay.
That I had SLE.
Yeah. Wow. Yeah. So I was telling Laura, who was on here before you, this was a little bit of a different event for us as far as content. So a lot of times it's more medical, like with doctors and hospital systems and stuff, which is important. But we also wanted to kind of show people that, self-care is, is huge important too. And not that it's easy, but it's approach it. It's something that you can do at home. I was talking to Laura, and you guys have sometimes 6 months in between doctor's appointments, if you're lucky sometimes. So it's things that you can do at home to she was saying for her, she's found that managing her stress level has been huge for her. So we just wanted to do something that was more a little bit more along that line with breathing and the Reiki and Tai Chi and stuff. So yeah, I'm really happy that you got to come out today. What's been, do you think, the biggest challenge for you, as a patient so far with the way lupus affects you specifically?
The biggest challenge for me is managing my lupus.
Yeah.
Making sure, it's hard sometimes when you have flare-ups. And your doctor's appointments is so far away. And then you go to the emergency room and that's packed and you don't know when you're going to see a doctor.
Yeah.
My biggest challenge is knowing how to manage it when I'm not able to go to my appointment or go to my a doctor's appointment or go to my to the emergency room, knowing how to deal with it when I don't have anybody around me. That's my biggest challenge. I didn't have lupus so long in my body that by listening to the ladies speak today and getting to know some new ideas to knowing how to manage it, it just, it's overwhelmingly surprising.
Yeah, in a good way though, right?
In a very good way, an excellent way.
Yeah, it makes you feel like you're not broken,
you know what? I enjoyed myself. This was such a blessing. If you have lupus and you don't have that support and you know that you have flare-ups, this is a wonderful place to come. Join the organization, be a part of us. Like I said, this is my first day of coming to the lunching and but joining the support groups.
Do you go to a support group?
Yes,
I was going to ask you that. Which one do you go to?
Chippewa.
Okay.
I have been there.
Okay, so at our office.
Yes, and I'm also going to visit the one in Maple Heights.
Okay, yeah.
I'm gonna go
Miss Dorothy. Miss Dorothy will take care of you.
Yes, both of them.
She's a good lady to know. That's for sure. That's for sure. I saw her getting some Reiki over there in the chair. She was enjoying herself a little bit.
Yes.
Miss Dorothy gets whatever she wants whenever she comes to events. We're like, you just
Yes.
she's the guest of honor always.
Exactly.
Well, that's awesome. I'm really glad you were able to come
Miss
today.
Rita, she's
Yeah.
been a big support
Yeah.
to me.
Yeah, Rita's awesome.
Like I said, it's just like a candy bowl. There's so many wonderful gifts that's here, or
Yeah.
that's enjoyable. I really enjoyed myself. I appreciate being here.
Yeah.
Coming to the luncheon and everything, and listening to the support that
Yeah.
we have.
Yeah, we always stress, obviously in today's world we do a lot of virtual things, and we make available, obviously, like we're recording right now. We make available a lot of resources online for people so that we can, meet people where they're at first. But
exactly
the in-person events, so important. I mean,
God.
whether it's 10 or 100, everybody usually leaves with a smile on their face.
You know what? You're right. Whether it's 5, 10, 15, we all enjoy ourselves. There's not a sad face leaving the door.
There's good food.
And the advice and the encouragement, like I said, I don't see the people. It should be a room full of people here. Well,
and from all walks of lupus, and all walks along their journeys too. Suzanne had to leave a little bit early today, but if you talk to her when she got diagnosed, there was one book about like yay thick, maybe 20 pages about lupus when she was diagnosed, and that was it.
Oh.
And they told her to go home, get your affairs in order, because you're gonna die. And that was when she was 23, I think, and she's 73 now.
See,
so and so when you saw her give that passionate, I mean, that was real. Exactly. That is how she feels.
Exactly.
And that's how she walks into the office every day. When she comes in.
I'm one of the ones that want to go and fight to keep this foundation, to keep it going. I want to be a help and a supporter too, to help support this organization, because it's very important. It's important to me and a lot of other people that's like me. That wants to live, that wants to be loved, that wants the listening ear, or to know how to manage and take care of ourselves from head to toe.
Absolutely.
Mentally and physically.
Well, I hope we see you at the walk in May.
Definitely.
And thank you for coming today. Yes. Thanks for talking to me, and I wish you well.
Thank you so much. Thanks.
All right. So Miss Laura.
Yes.
We just went through, I got it right. We're kind of wrapping up right now with the breakout sessions and everything. First of all, you are a lupus patient, you said, correct?
Yes, I was diagnosed in August. I went on my birthday, August 8th, to see why my hair was coming out.
Okay. Of this year?
No, 2017.
Oh, 17. Okay.
And then on August 18th, 2017, I got diagnosed that I had a low count of lupus that affects my skin.
Okay.
And like 3 days later, I started working for DFAS.
Okay.
The government on August 21st, 2017.
Okay.
So for that first year, I had no symptoms. And then that following year, I had symptoms.
Okay.
Like pain in my legs and joints. And I just was like, but I didn't really think it was from the lupus. I think it was from the stress working for the government.
Yeah.
To be honest. I'm totally honest.
Yeah.
And then I was able to work at home full time.
Okay, well, that's nice at least.
Because the federal building was so nasty and different things. But all the time, it was like I used to journal how I felt.
Yeah.
I was always nauseous.
Right.
Like when I wake up in the morning.
Yeah.
So I was like, okay, I need to prepare some type of breakfast so I wouldn't be nauseous, and to take my medication.
I got
you. I just kind of put up my own little plan for how I would deal with this. Because like I said, I had just started working. And like now, and I'm an avid roller skater.
Okay, well, that's good.
Keeps you active, Yes. And lupus runs in my family, and sarcoidosis runs in my family.
Okay.
My mom had sarcoidosis. Her sister had sarcoidosis and lupus. My aunt Mildred.
Okay.
So I knew it was in our family. And then, I just noticed how my skin was and different things. So I was like, okay, once they gave me the medication, which was hydroxychloroquine, to keep it from spreading.
Right.
And then other than that, I just watch my stress level because
Yeah.
it thrives off of stress.
Yep.
I noticed that.
Yeah.
It thrives off of stress.
Yeah.
And then I'm like, sometimes my legs, I can't walk. Like
Yeah.
I got up one morning to use the restroom to get ready to go to work, and I couldn't walk.
Yeah.
So I was like, okay, all right, this is something I don't need to take lightly. But after that, I was like, okay, what do I need to do to keep myself from being downtrodden?
Right.
So I continued to skate.
Yeah.
And then I noticed if I'm stressed about something, I can't skate.
Yeah.
And I was like, oh no, you're not gonna. I gotta skate.
Yeah.
I gotta skate. I can be sick as a dog, but I'm gonna roller skate.
Yeah.
So now I'm channeling my energy with the point where I'm like, okay, I'm in pain, or if I don't get enough sleep, I notice things, how I feel.
Yeah.
I'm nauseous. If I don't get the right amount of sleep, I'm in pain. And so I was like, okay, I gotta relax and do for me, because nobody else cares about that. So that's what I've been focusing on, and I love to travel. Whether it's getting in my vehicle and just driving to wherever. And even during COVID, I caught COVID once in 2020, and then I never caught it again.
Right. Well, there you go.
I never caught it again, and it was like, okay. And I was like, okay. People was like, well, how many times have you had COVID? And I was like, I don't think I really had it, but at the time I had a sinus infection, but I didn't have no symptoms of the COVID.
Right.
Like I didn't feel sick or anything. But after that, but come to find out during that time, I was stressed regarding a situation at work. And I was like, it's the stress. It don't matter what it is.
So has that been the biggest thing that you found?
Yes,
is for you at least?
Me,
yeah.
For me. So after I learned how to not let the stress be the focal of me and how I'm feeling, then I'm good. Like I can skate now. I travel and skate, and I'm feeling a whole lot better.
Girl,
and my hair is starting to grow back.
Well, there you go.
Because before, like, I don't believe in wearing wigs and all that.
Yeah.
I'm how I am. If anybody knows me, this is how I am. I don't care what you feel, say, or think about Lord Lynette Lewis. That's fine. So I'm good. I'm good. But these kind of things, I'm not alone in these kind of programs, and the Lupus has helped me. The Lupus Foundation has helped me a whole lot. I just want to thank them a whole lot on my medications and just different things that I need. And this was a really good thing. I wish, I'm going to be out there promoting so more people can come and get help with their lupus.
It's a little bit of a change for us.
It's not just for women, or it's not just, I know men that have lupus.
Right. Yeah, exactly. Yeah, this was a little bit of a change for us as far as like getting away from just the strictly medical.
Right.
Just because, like you said, for you found that, just stress, managing your stress level has been the biggest thing for you. So we wanted to give people an option that, like learn about things that lifestyle changes more or less, because that can have a huge difference. And I don't think a lot of people are really, I think they're aware of it, but I don't think they realize how big of a difference it can make.
Exactly. Instead of focusing on what's wrong.
Right.
Just relax. Like she said, those breathing. I do that all the time. And when I roller skate and the music sounds good, I'm doing this.
Yeah.
I'm like, I'm breathing.
Well, especially with you guys, between 3 to 6 months you guys have in between doctor's appointments sometimes, depending on the how busy the doctor is. So I mean, it's, what are you going to do, make the appointment and then just sit there and stress about it the whole time? Or like, what's wrong?
I see a team of doctors.
Exactly. Every ologist, right?
Medication messes with my rods and cones in my eyes, so I see an eye doctor for that, ophthalmologist for that, and I see my dermatologist, my ENT, because all the time they thought I had swimmer's ear. All the time it was eczema, and then everything's intensified with the lupus. So, and I was like, my ears swell, and I can feel it. My eyes swell. My face, everything, it fails. I'm like, that swells. That's the inflammation.
Right.
So as soon as I realized that, I was like, oh, okay. yeah, and then it'll go right down when I do certain things. I'll just, like she said, breathe. I'm like, okay, I have to concentrate.
Is that a lot of what you do is breathing, like for your specific stress relief and stuff? Do you do a lot of breathing exercises?
Relax, just relax. Like people's like, oh, are you worried about your job? I'm like, no. I got a plan. I can finish my degree, go back to school, get my unemployment. I'll live off my TSP for 1 year, and then I'll go back to the medical field probably and work. I've worked all kind of industries, so as long as I have a job to pay my bills, I'm cool.
Oh, there you go. Like, and that's a good way to look at it.
I'm not worried about nothing right now at this point, but it took me a while to get here.
Yeah, exactly. Yes. Yep. Well, and that's why we try to keep doing these programs too, is, we try to, especially in person. So, I mean, we there's a lot of virtual things we do, obviously right now we're recording stuff, and that does help. But what we found is, when we do in-person programs like this, I mean, sometimes you got to drag people in kicking and screaming. I don't want to go, but everybody leaves with a smile on their face usually, and everybody feels, because like you said, you realize you're not alone.
Yeah,
it's not just
you. Started at 10.
You're fine. Hey, that's the brain fog, right?
Right. I was relaxed. I'm like, oh, it started at 10. Oh well.
That's funny. What was your biggest takeaway from today out of all the speakers, you think?
Just that I'm not alone, and that like she said, just breathe and keep your body upright, and which I always do, and just keep doing what I'm doing, and let my light shine so that others will see.
There you go.
Yeah, well, she has it. And,
yeah,
but you always gotta, if it's something that, okay, go get yourself checked out, and don't. Yeah, because we're all different. So just get it checked out, and just pray. Continue to pray. I am a praying person, but usually I always have a smile on my face. Yeah. And I tell people, if you don't see that smile, whether you know me or not, you have the right to ask. Is something wrong?
Right.
But they don't never see me not smiling. So,
nobody ever.
Right.
Well, Laura, thank you for coming today. Thanks for sharing your story. You have a great day. Keep smiling.
I need to fill this out?
Yeah. All right, sweet. So I am joined by Larissa, correct?
Larissa Jackson.
All right. And we just wrapped up the minority retreat today. What'd you think, first of all?
Oh, for this to be my first event, it was amazing.
Yeah.
Very informational. I love all of the guest speakers. And I came with my cousin, Laura, who's amazing.
Yeah, I talked to her earlier. She's very sweet.
Yeah, she's been living with the disease for quite some time. And so anything that I can do to be in support of her, that's what. And I'm a community health worker, so it's a variety of reasons
there you
that
go.
I'm here
there
today.
you go. Do you so obviously your cousin, like you said, do you come across a lot of lupus patients in at your job?
Well, as of right now, it is not. I have not seen it, but I just started this role.
Oh, okay.
However, I was a medical assistant for 17 years, so I seen it.
Okay, yeah,
often
in that
role. So that's what brought me here today. Was I just wanted to have. I'm an educator, so being an educator, I want to be able to take this back and share information with the team as to. Or the patients as to what they can do and develop an action plan that's more consistent with what they're going through.
Yeah, absolutely. And I don't know if you talked to Rita or not, but we actually, speaking, since you're a community health worker, we actually have a program with Metro Health to provide continuing education credits.
Yeah.
Yeah. Okay, good.
Yeah, I've done a class already.
Okay, perfect.
So I've heard of, I did actually a Zoom, and I think I got 3 credit hours through Metro.
Perfect.
So that is who I go through for my continuing education credits. So.
Yeah, we like to do that because, like, you guys being community health workers, especially, depending on the communities that you serve, you guys are often the first people, the first line of defense, so to speak, is what we like to think of it. You know what I mean?
The skin.
Exactly. Yeah. Exactly. Yeah. So they're usually coming to you guys first. So you guys are seeing it, a lot more. So, educating you guys in your organization so that, at least at the very least signs and symptoms to look out for. Like, hey, because a lot of people don't, and they just brush it off, or, hey, oh, that's just a little rash, probably allergic reaction or something.
Yeah.
And, so that's awesome that you took. I'll tell Rita, she'll be happy. She's very proud of that one.
Yeah, I did it. I think I want to say
It was recent, like very recent, that I did.
Yeah, we
the Zoom.
re-recorded it this year, so it's actually like on demand now. The last time we did it was just live, and then that was it.
Yeah.
So we wanted to record it and put it like on whatever platform that they have at Metro,
Yeah,
so
pretty
people
cool.
could take it. Yeah.
Yeah.
Yeah. So awesome. So what do you think the biggest takeaway from today was for you?
The biggest takeaway is the importance of self-care. And I'm a strong advocate of, first of all, your mental health is the foundation of what we do on a regular basis. Without you having a strong mental health, it makes it almost impossible to love or take care of yourself. So just all of the varieties of ways to take care of yourself, the importance of your skin, what you're intaking as your output, and recognizing the importance even of meditation through this process. So.
That's awesome. And then as far as like from a caregiver perspective, you mentioned your cousin, and that's, one of the reasons that brought you here. What kind of advice would you give for, a caregiver on how to support somebody relative with either lupus or just any really autoimmune or chronic illness?
Yeah, I think, and I know for a fact it's important to have those discussions with your family to see what they are experiencing, and possibly if it's something that you might start experiencing. There's no age that comes with this. Because it's autoimmune, it can happen at any time. So it's important to have those conversations. And most of all, the more education you have, regardless to if you're coping and dealing with it on an everyday basis, the more you're out to share or learn, the more you're able to communicate what it is. So but I like it a lot.
Well, good.
Learning.
Glad.
I love learning. So.
Thank you for coming today. Thanks for sharing your story.
No problem.
All right. Have a good day.
You do the same.
Thank
Bye,
you.
y'all.